Good morning, everyone. I just wanted to do this video. So if you're new here, kindly subscribe to my channel and please make sure you share it after watching the video. Welcome back to Jamie's Convo. Okay, so this is May. We are in May month, and May is a purple month. That's a month that we use to create mental health awareness. So by now, every mental health unit is creating awareness. They go for health talk, school health talk, radio talk to preach about mental health, to let people know that it can be cured or it can be managed. When you receive the treatment early, it can be cured, but when you leave it to be a chronic disease, then you have to manage it. So this morning I want to talk about mental health and spirituality. I think most of people associate mental health with spiritual. They think it's a spiritual thing, and if someone is having mental illness, it's a some witchcraft that's doing the person, or it's a curse. No, it's not like that. It's like having malaria. If you are having malaria, you see the symptoms, right? You can see that you're having a little bit headache, see that you are a bit cold, and you start losing appetite, feeling weak. Then you see that maybe you're having malaria, so you have to go to hospital. They will check, they do malaria test. They will see that there's malaria parasite in your blood. Then when they do the test, they prescribe a medication. You go, you buy it, and you start taking it, and you'll be okay. That's how mental health is. When you see the symptoms, you just go to hospital. Like you are going to hospital when you are feeling like you're having malaria. When you don't feel well, you see that you're having headache, and you're going to hospital for doctor to prescribe a medication for you. It's the same as having mental illness. It's not a spiritual thing. So when you see the symptoms, so what are the symptoms? Maybe the person will start talking abnormally. Let me put it that way so that you can understand what I'm trying to mean. The person will be talking, and you see that the talking is not like as you and I, as a normal person talking. You can see that it's some way. Then the person starts neglecting the hygiene. The person will not paste, will not bath. You see that the person is being on when the person put on a cloth, the person is on that cloth for about 3 days. The person is still wearing the same cloth. Then you go to the person's room, you can see that the person's room is not kept. Room is not kept. Then when you pass by the person, you can smell. Then you see that there's something is wrong. Then the person will start being restless. Then the person may be pacing around. If he or she is your neighbor, you can see the person will be pacing around a lot. Maybe is the type that doesn't like talking, but right now you can see the person talks much. The person will be sitting there and talking to him or herself. You can see the person say that he's talking to him or herself, or pointing at some direction and talking to that direction where nobody is there. Then you see that there's something is wrong. What will you do? You cannot do anything. What you have to do is you have to go to hospital. You take the person to hospital. Just as simple as that. Any hospital, any nearby hospital, take the person to the hospital and let the mental health workers continue. So maybe you don't know where the mental health unit is. So what you have to do is you just go to the hospital. When you get to the OPD, you ask them the records where you take whenever you are going for, you are not feeling when you are going to hospital for checkup or see a doctor. You see, you take your car to some specific room. Right now they are using LEMS, they don't use the folder anymore. So you take your card to a specific room, they will activate your card for you, then they will give you direction, go to consulting room, and the doctor will sort you out. It's the same as that. Take your card to records, then ask them, you are going to the psychiatric unit, or where is the or when you get to the hospital, ask any nurse that you see, or anyone, or the security man is the best person to ask. You ask, please, where is the psychiatric unit? They will direct you. If they don't have, they will direct you to any hospital, any nearby hospital that they have the psychiatric unit. You go, then the nurses, the psychiatric nurses there, or if they have clinical psychologists or clinical psychiatrists rather, then they will take it from there. So if you see all these symptoms, don't sit at home and saying that. And I'm not saying that you should not pray. When you're having malaria or you're having BP issues, you go to hospital, you take your medication, and you add prayers to it. It's the same as mental illness. Take the person to hospital. Let the doctors, the psychiatrists do their work. Then add prayers to it. Don't take the person to prayer camp. You'll be restraining the person, chaining the person. The person will be sitting under a scorching sun. And that's how they will tie the person to some tree. The person will be sitting under a scorch. When it's raining, all these things, the person will be in it. By the time you take the person back to the psychiatric unit, the mind, the brain has already damaged. Sometimes the time I'm taking the person to the hospital, now disease now chronic. So what we have to do is just manage. But when you see the symptoms early, you detect the symptoms early, you come to hospital, the doctor will do psychiatric assessment, they put the person on the medication. But when you sit down, then the brain is already damaged and all. What we have to do, just manage the person. One thing about psychiatric illness is mental illness. Some people, they are lucky enough, so when they take the medication for take medication for a while, they are able to the doctor take them off the medication. Others, they will be on it till they die. It's like taking the BP medication. You have to take it every blessed day. And the psychiatric medication is not like the malaria one. Maybe you're having malaria and today you decide to skip your medication, nothing will happen. But when it comes to our medications, you don't have to skip it. You have to take it as prescribed by the doctor. Every blessed day you have to take it. When you skip it, you will relapse. And when you relapse, the condition becomes severe than it was. So you have to take it every blessed day. So we have medication. If you don't know, I'm telling you, you have medication for mental illness. So it's about time you stop associating it with spirituality and all those things. If you have a family member, a neighbor, or a friend, a loved one who is having these psychiatric issues, if someone is having, even though you are not a psychiatrist or mental health practitioner, you can see that this person is behaving abnormally. If someone is behaving abnormally, you can see that there are some petty things that you will see, as any person will see. The person doesn't need to be a psychiatric before the person detect that. When you come, we have certain things that we will see for us to prescribe the medication for it. But if the person is behaving abnormally, you can detect it. Take the person to hospital. Don't sit down. It's not spiritual thing. It's the brain. It's like having a headache and taking it to hospital. It's like having stomach pains and you take the person to hospital. It's the same as mental illness. So this is May. We are in May and we are creating awareness, mental health awareness. So mental illness is not a spiritual thing. Take the person to hospital. That's all. Please like the video, subscribe to the channel. See you next time. Bye bye.